This is Bill Benson of WebMedicareSupplements.com, a proud supporter of Dr. Bob's Medical Moments. Wherever you are, WebMedicareSupplements.com is your source for affordable Medicare and long-term care insurance. We can be reached at 800-748-5776. Once again, that's WebMedicareSupplements.com, 800-748-5776. And now, Dr. Bob.
Normal physiologic process and occurs when the ovaries lose their ability to ovulate and produce hormones, in particular estrogen. Although normal with age, the inability to make estrogen causes discomfort and some serious health issues for women. The brain recognizes the drop in estrogen and responds by secreting other hormones. GnRH and FSH attempt to stimulate the ovary to get back to work. It's like pouring gasoline on embers of a fire. GnRH and FSH are commonly secreted at night and cause blood vessels in the face and chest to dilate, an overwhelming sensation of heat, possibly sweating, even EKG changes. Traditionally, these are called hot flashes, experienced by 80% of women. As ovulation ceases, the uterus no longer bleeds monthly or have a period. Menopause is defined as the lack of bleeding for 1 year. The average age of menopause is 52. Other symptoms of menopause include irregular bleeding initially, dryness and lack of elasticity of the vagina, trouble sleeping, forgetfulness, mood changes, depression, and lack of libido. Many of these symptoms are the result of nighttime hot flashes and difficulty sleeping. To the men who are listening, if I woke you up every 15 minutes, you'd have mood changes too. The base of the bladder is also estrogen dependent, and many women have urinary frequency or urgency with menopause. Osteoporosis is a loss of calcium from the bone and occurs in both men and women as they age, but much more so in women with loss of estrogen. Dry mouth and cavities are more common after menopause, so be sure to brush your teeth frequently with a fluoride-containing toothpaste. Estrogen helps keep blood vessels open and relaxed. It also helps maintain good cholesterol. So after menopause, there's an increase in heart disease and stroke. To reduce these risks, practice a healthy lifestyle. Quit smoking, exercise, eat properly, take daily aspirin, see your doctor for wellness checks, including blood pressure monitoring and treatment. Hormone replacement therapy is medicine to help alleviate hot flashes and vaginal dryness. Menopausal hormone therapy is safe, but it does have risks. The FDA advises women who want to try hormone therapy to use the lowest dose that works for her in the shortest duration possible. There are many estrogen drugs used to treat hot flashes and vaginal dryness, difficulties sleeping, and prevent osteoporosis. Conjugated estrogen, or Premarin, has been around the longest and has been studied the most. But some people object to its use because it comes from horse urine. For women with a uterus, progesterone must be prescribed along with any estrogen to protect her against uterine cancer. While progesterone protects against uterine cancer, the risk of breast cancer is associated with the progesterone that's added to estrogen. Women who took estrogen alone had a lower risk of breast cancer even after many years. Women who took estrogen plus progestin were more likely to be diagnosed with breast cancer, and these cancers are more likely to be advanced. The risk of breast cancer was greater the longer the women took combined hormonal therapy, that's estrogen and progesterone, but it decreased when hormones were stopped. For this reason, estrogen with progesterone therapy is generally limited to 5 years. Both estrogen and estrogen with progesterone have been associated with stroke and an increase in blood clots. these risks are higher in women over age 60. With 18 years of follow-up, the Women's Health Initiative study reported women who took estrogen plus progesterone or estrogen alone had lower risks of death from any cause. Women with early menopause should take hormone replacement therapy until the age of physiological menopause, 52 years. Topical hormone therapy is a low-dose estrogen cream applied to the skin, a vaginal ring or gel that's applied in the vagina. This type of hormone therapy can help with vaginal dryness, but not other symptoms. So if you want to consider taking hormone replacement after menopause, see your doctor for a wellness check and a review of your options.
Thank you, Dr. Bob. Wherever you may be listening, WebMedicareSupplements.com is your affordable source for Medicare and long-term care insurance. We can be reached at 800-748-5776. Once again, that's WebMedicareSupplements.com, 800-748-5776. Stay tuned for more of Dr. Bob's Medical Moments.